Hello, everyone. Welcome to our presentation. My name is Giselle, and I'm here with Karen and Melanie. Today, we're going to be doing our presentation on Chapter 4 from our textbook, which focuses on the pre-contemplation and contemplation stages of addiction initiation. We will be explaining how early attitudes, exposure, curiosity, and peer influences can shape the pathways into substance use. We will also be integrating concepts from pathways from culture to addiction, recovery by White, showing how early experimentation is the first point where individuals begin shifting towards the culture of addiction. And then finally, we will be presenting a client case study and applying the TTM, DSM-5 criteria, and the SUD screener.
Okay, so we're going to talk about overview of chapter 4, which talks about early stage of addiction formation, the pre-contemplation stage, which the client has no intention to change since he doesn't know or she doesn't know that she has a problem. Contemplation, when we are starting to see the curiosity of trying or of maybe thinking about trying something to get better and get a solution, but this is just the idea of. We're going to see also the exposure and the peer influence and how that affects this decision, and the prevention must match development.
In the pre-contemplation stage, people usually aren't curious about the addictive behavior and often have negative views about it. They don't see it as something that fits their values or identity. Protective factors are strong and their exposure to risk is low. Their environment, like home, school, work, and friends, tends to discourage the behavior, so they're mostly outside a culture of addiction. They understand the risks and how the behavior could harm themselves or others, which helps them feel confident in saying no and staying away from it.
Okay, so moving out of the pre-contemplation stage happens gradually. A person usually doesn't wake up one day suddenly wanting to try a substance. Instead, curiosity slowly increases while protective factors begin to weaken. This could mean that parents become less involved, friends starting to experiment, or more freedom that exposes a person to situations where substances are present. Exposure is one of the strongest influences. When someone sees friends, classmates, or older peers using without immediate consequences, it normalizes the behavior. That exposure creates temptation, especially in adolescence when fitting in and trying new things feels important to them. From the pathways perspective, this is the earliest point where the person starts stepping towards the culture of addiction. It doesn't mean they're addicted per se, but they're beginning to adopt small pieces of that culture, like new attitudes, increased curiosity, or new beliefs, such as, well, everyone tries it at least once, right? These small shifts mark the beginning of movement from protected identity into one that is more open to experimentation.
Okay, and so after the pre-contemplation, we get finally to the contemplation stage, which we have to understand it can be months, even years in between. There's not a timeline for the client to do this. So it goes at the pace that the client wants to go and how fast or how slow he can like actually move forward, right? And so on the first part of the contemplation stage, we can see that the client is evaluating the pros and cons. So this client might have feelings, conflicting feelings about the behavior. He might be like, well, if I quit doing this, I'm gonna lose my friends. I'm gonna lose my group of people. I'm gonna lose my everything that I know so far. But if I stop doing this, I might be better in my life. I might be have a better socioeconomic status because I'm gonna be able to keep my work. And so he starts waiting which one's better for him, right? Then we can see how that goes to like, I want to know more information about this. And so it goes to the increased openness to information. And so the client it's more receptive to learning about the behavior and its consequences. So at this point, we're seeing the client asking questions. We're seeing the client getting more information, understanding what a substance use disorder is, what it's affecting how it's affecting his life. Then we can see in this group supports and the client getting to this group supports and surrounding himself with people that actually can influence him, which this becomes a problem or it can become a solution, a support. So we can see, as Giselle was saying, that the influence can be really, really good or it can be really, really bad. We can see either one. And so this depends on what the client surrounds himself with.
Risks and protective factors are things that either increase or decrease the chances of substance abuse. Some risk factors include having friends who use substances, dealing with stress, anxiety, or depression, low parental monitoring, and struggling in school. These situations can make someone more vulnerable. Protective factors work in the opposite way. Supportive parents, religion, or community involvement, parasocial activities, and doing well in school can help protect someone and give them stability and support. Overall, a person's cultural environment matters. The people and values around them can strongly influence the path they take.
So the preventative strategies, so one thing we have to recognize is that prevention needs to fit where someone is developmentally. If you give too much information to someone that's like younger or like not ready, then it can actually make them curious instead of stopping them. So scare tactics along the line don't work because most young people have seen or heard of peers using without any like dramatic outcomes. So they don't fit those messages believable. What does help is building real skills. So things like handling peer pressure, emotional regulation, and good decision making. These skills help lower the chances of experimentation. Pathways also says that the idea of having supportive relationships and healthy activities and positive environments can make it less likely for a person to drift towards substance using groups.
Okay, and then we have the key takeaways, which is pretty much a little resume of what we have talked so far. So the initiation is a process, and so it goes to the pace of the client. The client can decide where to start, how to move forward, right? The pre-contemplation is this process can be all over, but pre-contemplation is usually the first step when the client notices that there's an issue but he didn't know before. So pre-contemplation, the client doesn't know there's an issue. Peers are starting to say there's an issue, trying to contemplate the idea, but not sure yet. Contemplation, we have mixed feelings about what's going on and what we can do. Are we quitting? Are we not? Can we quit? How important it is to quit? And then we have exposure, a model of shift stages, which talks about the peer support, and then prevention can interrupt progression and pathways, which is what Giselle was talking about early movement towards addiction culture.
This case focuses on Maya, a 19-year-old college sophomore. She lives with her mom and younger sister and works part-time as a cafe barista. Recently, Maya has started experimenting with cannabis after connecting with a new peer group that uses substances. She feels unsure about whether she wants to continue using, and she's conflicted. At the same time, she's been experiencing increased stress, and her grades have also started to decline. These changes suggest that her substance use and social environment may be beginning to affect her academic and emotional well-being.
Okay, so we chose to focus on Maya's social and mental health history. For this case, so socially, Maya has recently shifted from friends who didn't use anything at all to a group that uses cannabis pretty regularly. And that change increased her exposure, which makes it feel more normal to her, and also raises the temptation, which is how the early experimentation usually starts. And then mentally, she talks about, like Melanie said, feeling stressed and overwhelmed. And she started using cannabis as a way to relax herself. She doesn't have any formal diagnosis yet, but stress and coping issues, can make someone more open to trying the substance.
Okay, and so as we have learned in class, there are some tests that we can run in a client to understand the how serious this problem is and how can we help and the just to be able to diagnose what's going on and just to understand a little bit more and treat it, right? And so the first one that we did was the DSM-5, which the results was that Maya is presenting a cannabis use disorder. And the criteria for that is that she's having cravings, she's not being able to stop, and she's using more than intended. And then she is having consequences on that. She is having bad grades. She's not doing what she's supposed to do at her age, right? And so we are seeing that this is becoming a natural issue in her life. The other one that we did was the DASD, and her score was number 9, which Giselle will explain this later on and how we got those results. The TTM stage, what we think at her the stage that she is at, it's the contemplating stage where she is thinking about it, she realizes there's an issue and she is starting to like look what her options are. We understand that this is maybe like an early membership in a Dutch culture where like she tried it, she got hooked on it, and she's trying to like get a solution rather sooner than later, which is what we got from this. And then we're trying to rely on the interviewing, strengthening her support system, and giving her the balance that she needs in her lives.
Yeah, so like Karen said, we did the drug abuse screening test, which focused on, um, they had questions such as, has she abused prescription drugs? Is there a limit to certain drugs in certain situations? Has she ever been arrested for using drugs? Has a parent ever complained about you doing drugs? Have you ever been hospitalized for it? Stuff like that. So we went through her and we had her fill out this form. And we came to the conclusion that she was at a level 9, depending on her scores. And the regular range is 6 through 11, which is how you identify someone with cannabis use disorder. Um, and she fell right into there, into the 6 and 9 or 6 and 11 category. So this is how what we used to diagnose her with that.
And here are references that we used, chapter 4 in the textbook, Addiction and Change, the Pathways book by William White. Thank you guys for listening. I hope to hear your feedback.
Thank you.
Bye.